Yep, thanks for tuning in, everyone. We are now live for our second session of Founders Club. Today we have Dr. James with us as well as Celia, our moderator. Without further ado, I'll just hand the time over to Celia.
Yeah. So hi everyone. Thank you for coming down to join us for this session, and a very warm welcome to Beyond Health Hack 2021. So my name is Celia, and I'll be your moderator for tonight's session. So before we start, just a few administrative matters. Firstly, I would just like to ask everyone to keep yourselves muted. And if you have any questions during the event, you can either use the raise your hand function at the bottom of your screen, or you can also ask your questions in the Q&A session, the tab on the right-hand side. So we'll be filtering through these questions, and the most relevant or upvoted ones will be asked during the session. So do also know that priority will be given to those who would like to come up on stage to ask the question, as we would like to make this session as interactive as possible. So back to the main program. So tonight's session is our second Founders Club, and we hope that the first session that happened on Tuesday was an enriching one for those who had attended. So tonight's guest speaker is none other than Dr. James Wong, the co-founder of WhatsDoc. So thank you so much for joining us tonight, Dr. Wong. So before we take any questions from the floor, may I ask Dr. Wong to give an introduction about yourself and of WhatsDoc?
Sure. Thank you, Celia. Thank you, BHS, for the opportunity to be speaking here. It's a great pleasure for WhatsDoc and for myself. Hi, everyone. I'm James, the co-founder of WhatsDoc, the current CEO. WhatsDoc is a simple mobile app focusing on instant messaging with communities built around body systems and diseases. It's a simple introduction.
Thank you so much for the simple introduction on WhatsDoc, and hope everyone has an idea on what WhatsDoc is. So I personally believe that actually with today's technological advancement and the increasing reliance on technology in today's climate, WhatsDoc is able to reach out to a wider audience and bring about a more positive impact to the health of many lives. So with that, we'll be moving on to the Q&A session. And maybe to kickstart, Dr. Wong, may I ask you a question? So may I know, what do you see telemedicine as a future norm in Singapore, and what do you foresee the climate to be like?
Oh yeah, totally. I think definitely telemedicine has its merits to bring quality clinicians affordably and accessibly to everyone. So definitely, I think it can be the better norm in the future, together with traditional healthcare. But of course, do not get me wrong, telemedicine has its limitations as well.
Okay, so perhaps could you elaborate on what are the foresee challenges you see that telemedicine may have?
So I think telemedicine has long been practiced actually from before. It could be as simple as picking out a phone call and calling your patients to follow up. That's a form of telemedicine as well. It's just that with now the new generation of telemed, whereby you actually have a video call, and even further on, you have remote patient monitoring devices to give you some sort of objective measures, vital sign readings. But like what I mentioned earlier with its limitations, you are not able to palpate or examine a patient. So it's also pretty new. So I think every stakeholders are trying to regulate and thread safely in this space. So I think one of the challenging factors I would foresee would be to thread within the regulatory matters and also to overcome its limitations.
Thank you so much, Dr. Wong, for the thorough explanation. Just a reminder to the floor that if you all have any questions, do feel free to list your questions in the Q&A segment at the right-hand side, or you can use the raise hand function at the bottom for me to invite you to the stage to ask your question. So maybe another question for you, Dr. Wong. May I know, how does WhatsDoc differentiate itself from other telehealth companies such as Doctor Anywhere, MHC Care Plus, and Setacom Health?
I think by being ourselves, really, the core difference in every startup is the DNA, the people, and the culture. And it's quite hard to say who is better, who is the winner, but just here to be different. So do it your way and try to avoid chasing or following features. Because if you do that, you're going to be trapped and you're always going to be behind. So I think we all have different features, and I think if we could all, rather than compete but collaborate together, it would be a win-win situation.
Okay, thank you so much for the response. Can I just clarify, like, what do you think is the main feature of WhatsDoc, or like the trademark that makes WhatsDoc like a very distinguished telemedicine company?
One trademark or one key feature perhaps I like to think that we have done well is its user experience. Um, I think it's important to focus heavily on that because a user is going to use a simple feature product. It gives you good experience over a feature-rich product that requires you to say read a 50-page manual. So the very core feature that we are quite proud of, I like to be proud of, is our UX lah.
Okay, thank you so much for the sharing. Okay, we have a question from the floor. So it's by Ruth. So, hi, Dr. James. What innovations have been seen in telemedicine since it first started? Is there any room for greater improvements?
So, like I mentioned earlier, telemedicine has actually long been practiced from the very first gen of telemed, whereby it's a simple phone call. But now with the video component of things, and even moving forward, with faster internet connectivity, with better data management through blockchains, um, and also better remote patient monitoring device, so that you can actually get instant readings from doing teleconsults rather than just a communication. So I think there are great room for improvement for telemedicine, especially in this region, Southeast Asia. It's still pretty infancy. I think there are a lot of opportunities, a lot of market segments that um, you know eager students here can tap into.
Okay, thank you so much for the sharing. So you mentioned that telemedicine is like a pretty in the infantry stage, right? So we have one question from the floor. So it's by Ang Feng Aaron. So he asked, like, what are some of the biggest challenges you face with telemedicine that you face, and what do you foresee in the future?
Mm. I think so. I think one of the question earlier is do we think telemed will be the norm, right? So as we all know, the conventional or traditional norm of seeing a doctor is to go down. And of course, with new things, new changes, one of the biggest or largest challenges would be education and awareness. So you need to get people to aware and to educate them the benefit of using, for them to trust using telemedicine. And not just on the patient side, but also on the clinician side. Clinician needs to be able to buy in as well. So your customer is not only just the patient, it's also the clinicians and other stakeholders such as the government, the insurers, and others.
Okay, thank you so much for your response. So maybe just to add on to the question, may I know, do you foresee telemedicine to be a full replacement of our current doctors, physicians, and healthcare professionals? Or do you think there still needs to be this group of people to help with the telemedicine in terms of its working functionalities?
I mean, yeah, definitely. I don't think telemed can replace. There's no way you can replace the gold standard of healthcare, whereby you get your in-person consult. But it can act as a really good supplement for follow-ups, for first triage, or for patients that finds it hard to travel to a clinic, for example. So it will not be able to replace, but together it can work as a great supplement and adjunct to healthcare.
Okay, thank you so much, Dr. Wong. So we have another question from the floor. It's by Chin Jia Yi. She asks, may I ask how you build or are intending to build a user base?
We started off really basic. We approach people we know first, clinicians that we know, and then it just spreads through word of mouth. Clinicians that have used it find it easy to use, like the idea whereby we are multidisciplinary and they introduce one another. So slowly, that's how our clinician segment um, grows. And later on, then of course, we went into all the different other marketing tools. As for the user side, the patient side, again, also I think we started with people that we know, friends and family first. Then eventually, we go through all the digital marketing, so the different tools.
Okay, thank you so much. So another question from the floor is by Philip. She asked, you mentioned earlier that collaborating with other similar companies would be better than competing with them. So what would be the main benefit you believe that such collaboration would bring, or would it have the greatest benefit, or would the greatest benefit be the increase in manpower?
I think every company, although somewhat similar, but we have different USPs. So I think combined, we are able to strategically say tap into different markets, be it domestically or overseas across, say in Malaysia or Vietnam. I think other than just the manpower, but it's also for strategic reasons, lah. Mm. Sharing of knowledge, expertise, um, market access as well, very important.
Okay, thank you so much for the reply. So just to add on to the question, besides like collaborating with other similar companies, what do you think about collaborating or like working in junction with existing healthcare infrastructure, for example, like National Electronic Health Record? So do you think that like while working in conjunction with such healthcare infrastructure, will there be any disruption since like both involve like the use of like e-health and m-health?
Yeah, I think definitely find ways to approach existing players, existing providers, and see how you can tap into and what sort of features or offerings you have that they do not have. I think by working together, you probably will get a head start than direct head on.
Okay, thank you so much for your response. So, one question I have would be like, what do you think are some ways that chronic condition management can be done better or improved upon in Singapore? And do you think like telemedicine can play a big part in managing chronic conditions?
Yeah, I didn't have a simple answer to that, but chronic management has always been a provider-patient dance, a tango. You got to educate the patient, empower and enable the patient. Take just diabetes as an example. How do we better educate, empower and enable the patient? How do we educate them in a way that they really understands? And is there a more regular follow-up? Is there a home outreach, for example? So I think telemedicine certainly can play a role. I think it has already started even in Singapore with a lot of tele consultations, education over the mobile and close follow-ups even with dietitians, with allied healthcare professionals checking on, what the patient has been taking, whether the family members has been checking on the blood sugar control. So definitely, I think telemedicine can help in chronic management control.
Okay, thank you so much for your response. So maybe another question is, what do you think are some of the significant drawbacks of telehealth as compared to like face-to-face consultations? Or like what do you think are some of the features like where people will choose telemedicine over like other methods of treatment such as like face-to-face or like just going down to the clinic?
I think for conditions that are chronic, especially, and sometimes you may not need to go down and queue for long hours just to collect a report or just to check how you've been feeling. So a lot of the known cases or chronic cases can be followed up online. Um, and for those that are probably first consults or complicated cases or something that requires an examination, investigations, or certain conditions where it's a bit more acute or urgent with certain red flags. So those would not be suitable for telemed, and definitely those would have to be in-person consult.
Okay, thank you so much for your response. So we have a question for we have another question. So it's by Benson. So he asked, with the advent of telemedicine in Singapore, we have seen a multitude of telemedicine-centric startups and companies. And thus, in this competitive environment, what advice would you have for our participants to best differentiate their proposals?
I think really have to identify a unique problem statement that has not been answered and come up with a solution for that. Um, Singapore is a really small space, really small market with a lot of players, a lot of people watching as well. So it's a good place to try out as a proof of concept, even a proof of value. But if you can address your market segment right here, and I think definitely try to scale early overseas.
Okay, thank you so much, Dr. Wong. So we also have another question from the floor. It's by Amelia. She asks, hello, Dr. James. Since elderly are usually less tech savvy, may I ask how you manage to get the elderly to be on board?
Um, it's difficult, but we do. For example, if you find that they are less tech savvy, then you would have to perhaps send a team to say certain centers and try to get them on board and teach them how to use, or maybe even have a dedicated device at certain centers with trained personnel to teach them how to use it instead of reliant on their own mobile, for example. So say if you're at a center with a lot of elderly, you could have a dedicated room built for teleconsults.
Okay, thank you so much for your reply. So maybe just to add on to the question, so do you face any scenarios where patients upon receiving help through your company, they start being rebellious, or they find that your consultation or your advice might not be suitable for them, because they are not having the face-to-face consultation where they can feel the link or the connection. Are there any patients who might not follow any of the advice given?
I think, of course, as you embark on your startup, on your journey, not all users are going to be happy. But I think service recovery is very important. After all, it's a sort of service. So ensure that you have proper protocols, SOP in place to really follow up, to address every comments or remarks. So that's quite important. So that's why I've always been telling our team that if they are be it happy or unhappy comments, we do have to address and try to fix it as soon as we can.
Okay, thank you so much for your response. So maybe another question is, what actually inspired you to start up WhatsDoc? Is there a particular interest you had in telemedicine that inspired you to create WhatsDoc?
Well, I think WhatsDoc was started last year in January. Literally just came back from Japan, and COVID has not even hit yet. And then I was thinking, how could we do things differently? And that's quite important because we got to constantly ask ourselves, why are we doing things this way? Is there a different way? Innovate. I guess that's just who I am. I like to be different and think out of the box. And have to admit, WhatsApp is not the first in the space and not the most publicized. However, that's not stopping us from doing what we believe in.
Okay, thank you so much for your sharing. So we have another question from the floor. It's by Benson. He asked, as a pioneer in the telemedicine field, have there been any key learnings in earning buy-in from various stakeholders?
I think have to be put yourself out there, approach various stakeholders early, and start discussion early. Don't wait. Don't wait that don't wait till things are ready, your metrics are ready, your solutions are ready. But engage early. Talk to people. Yeah, as much as you can.
Okay, thank you so much for your sharing. So we have another question from the floor. It's by Xiu Jia Geng. So the question is, hi Dr. James, as development is progressing rapidly, do you think it will gradually replace the role of professionals such as doctors in the telehealth industry?
No, I would not think so. I think it's too complex. Maybe for simple back office task, perhaps, yes, but not as a consultation or diagnosis. And with AI, AI is based on data, huge sample size. You need to first of all be sure that you can have the enough sample size for the specific condition, the complexity, and and yeah. So I think it's a bottom line. I don't think AI can replace human consults for sure.
Okay, thank you so much for your response. So another question from the floor is by Chin Jia Yi. So she asked, may I ask if you have planned or are planning to integrate medical devices from other companies into your platform? And how do you intend to conduct this integration?
Yeah, I think we have been thinking about that all along as well, because very quickly we realized for a complete care, a holistic care, other than just tele consults, you need to integrate remote patient monitoring (RPM) as well as pharmaceutical provisions and delivery. So I think we have been thinking about this, have been sourcing a few companies as well. It's just really choosing the best, or even coming out with our own. But I think there are a few out there developed in Singapore, and we've been talking to a few potential commercial partners.
Okay, thank you so much for your response, Dr. Wong. So another question by Benson. He asked, so building on the AI ML question from earlier, do you see any point in the patient care journey where the implementation of AI and the delineation of workload with clinicians would be a value add?
I think with AI ML, certainly, like I mentioned earlier, it's of great help, especially with back office functions and to save time or workload of clinicians. So for that, certainly it will be a great help. But it will not be able to say take the clinicians out of the office and by just keying in a few symptoms to replace. But maybe as an initial triage, perhaps, yeah.
Okay, so building on, like just like to ask, do you foresee like any challenges you'll face if you had to collaborate with clinicians? So like will there be, instead of any value add, might there be any disruption or any like work of conflict or interest of conflict?
I won't be able to comment on that, unfortunately. I'm not too sure. Not in the AI space.
Okay, thank you so much. So yeah, like indeed telemedicine and clinicians will not necessarily conflict and will not necessarily conflict with one another, but maybe be a better benefit to each other in the sense, and also ultimately positively impact the lives of like the people around the world. So with that, we'd just like to ask, are there any more questions from the floor, or does anyone have anything to ask Dr. Wong? Okay, so we have a question from the floor. It's by Joshua. He asks, so hi Dr. James, in what way can a telemedicine company such as WhatsDoc be profitable in the long run?
I think telemedicine is really quite interesting. There are, quite a few business models that one can play with, or you can tap into different revenue streams with the huge data you have, or even from the very simple, direct to consumer transaction commission. But of course, there's quite a few different business models from higher gross margins to lower gross margins. So it's really up to how you you like to which business model you take on. So I think definitely it can be profitable in the long run. Yeah.
Thank you so much for the response. So maybe just to add on to the question, so how do you, while you say that collaborating with other companies will be good in the sense that y'all can tap on one another's ideas and also be able to work together to create like a better telemedicine future, but what do you think, how do you think you'll be able to distinguish yourself from the rest and also be like profitable in the long run, especially if there were to be more competitors coming into the telemedicine market since technology today is rapidly advancing?
You have to be different first of all, but it's I think it's quite hard to to be scared of by competitors or future players. You have to do what you believe in, and you do have to plan it out properly, with of course validations and business plans, financial plans. But I don't think one should be put off by having the potential future new players or competitors lah.
Okay, thank you so much for the sharing. So, Dr. Wong, just to ask if you have any tips for our participants, especially like for participants who would like to be entrepreneurs in the telemedicine and have their own startups, what kind of advice would you have for them? Because like personally, as I was listening to all your responses, like I feel that you should also have like some knowledge in terms of engineering to be business planning, marketing. So what do you think are some tips for those who might want to have a startup but like they're afraid to do so because they feel like they might lack the competency to actually like have their shift from a thought to an action?
I think planning is very important, but careful not to analyze and paralyze, because a lot of people is just all talk and think. Um, so it's quite important to really plan and do and execution. And I agree with you that to be an entrepreneur, a startup founder, you do need to know kind of like a bit of everything. Like I was in healthcare, um, no idea about tech, but then you have to start learning early along the way. I remember when I started tech, WhatsDoc, I actually started it on my own and doing all the tech with my tech team on my own, like almost daily with meetings, and learn all the different language and frameworks. Of course, now we have a CTO, of course, and you will need to know about marketing, about company structure, about financials and all that. Um, I think the best way to learn, because you can hear a lot of talks from doctors or lawyers to learn about their field, but you will never know how it really feels like to be a doctor or to be a lawyer, engineer, unless you are there in the hospitals or you shadow them. So I think the best advice would be to approach a startup and just be an intern to shadow a week, 2 weeks, a month even, to learn. I think that's the best way to find out if it's really in your DNA.
Okay, thank you so much for the insightful sharing. I think indeed like it's important for us to be able to learn, to be able to self-learn as early as possible so that we'll be able to let our thought come into action as well. Yeah. So thank you so much for the tips and advice. So we also have a question from the floor by Benson. So any plans to leverage the patient data gathered to implement novel functions?
Yeah, I think certainly that's a future option for us, with perhaps through the data we have, maybe we can introduce certain features, just as simple as if we find that users like to flow this way better, then we can perhaps provide that. Or maybe if user likes to request for certain features that's beneficial that they may find it a bit hard to achieve with the current flow, then we can do that as well. So I think definitely we build from data, we build from experience, we build from feedbacks. So that's important.
Thank you so much for the sharing. So we have one last question also from the floor. So it's by Tia Yi. She asked, I've noticed that your app offers services in 20 countries. So how do you manage to get so many doctors from so many countries on board in such a short time?
We started onboarding like I mentioned earlier, through word of mouth. So a lot of introduction. Like we only really wanted to launch in a few space, but the clinicians that have tried it out really love it and have been introducing our app to clinicians from other countries as well. So that's how we get connected and try to through the platform offer different services localized to the different regions.
Okay, thank you so much for your response, Dr. Wong. So due to time constraints, I would like to ask the floor for any last questions. So we'll just hand the mic over to Jia Yi. Hi Jia Yi, do you have any questions? Okay, so no worries on that, Jia Yi. So with that, once again, thank you so much, Dr. Wong, for taking time to give the participants of Beyond Health Hack 2021 an insight of your entrepreneurship journey. So I hope that everyone had a fulfilling and fruitful session, and we hope to see you in our next Founders Club, which will be happening on the 22nd of June at 8 p.m. So thank you so much once again for attending, and have a good night.